Perfect. And we're on. Perfect. Thank you, Dr. Luana, for joining me today. We're gonna be, or you're gonna be discussing about the project Verified, the project
Yes.
coordinator. Could you please introduce us your project?
Yes, sure. First of all, thank you for the invitation. It's really nice to be able to explain the project in a concise way, so I hope I will be clear. Um, so Verified stands for in vivo patient-specific real-time dosimetry for adaptive radiotherapy. I will start explaining the consortium, and then people will understand why we come up with this idea. So the people from the consortium are really complementary. We have the Belgian Nuclear Research Centre, where I work, and we are also the Belgian beneficiary. But we have a long story on dosimetry, and especially myself, I develop detectors for dosimetry. Then within my long year of working in Belgium, I have collaboration with several hospitals and several universities. So that's why we also have within Belgium the University of Antwerp, um, and then the group of hospitals from Antwerp. The University of Antwerp is not only the medical department that is together in this project, but also another department that is related to robotics and scientific vision in VLab. Um, and so this is the Belgian cluster of the project. Then we have the Netherlands, and in the Netherlands is the University of Maastricht. In the University of Maastricht, there is a group working on developing phantoms, 3D printed phantoms. And then we have our last but not least partner from Croatia. And in Croatia is the University of Zagreb School of Medicine. Here I have some pictures so you can more or less see the faces of everyone. Because of the time, I'm not going to explain who is who, but it's a concise, small consortium, but very well organized, and we interact a lot. And what is the main idea of the project? What we want to do, we want to advance individualized therapeutic procedures uh, um, for uh, for dosimetry for patients, and we're going to do that utilizing patient-specific information, imaging, real-time dose, um, and then we will combine that to make it applicable in the clinic using deep learning techniques. And we chose to, as that proof of concept, we chose to work in adaptive radiotherapy. This is an overview of the work packages in this project. It's just to show how one work package interacts with the other, and how, as a small consortium, everybody is collaborating with everybody. So because we are working with adaptive radiotherapy, one of the first questions was, we are not going to use real patients, but how are we going to work with adaptive radiotherapy if we don't have real patients to adapt? So this comes the expertise from the University of Maastricht, because they developed these 3D printed phantoms. And these 3D printed phantoms can breathe, can move, can change, and also we can introduce tumors, we can remove tumors. So then our patients in this project are going to be 3D printed patients that can adapt. So they will adapt during the treatment, the project. Um, so this work package is it's going to be used for everyone. So that's why it's in the beginning of the project. And then we have two sides. So one side goes to VMAT, adaptive treatments, and the other one goes to stereotactic radiosurgery treatments. One in the university, in the hospitals of Antwerp in Belgium, and the other one in the hospital in Zagreb in Croatia. So they are parallel, but they are one complement each other. So we are going to use real-time dosimetry and imaging in both cases. In one is the VMAT, so you have the linac rotating around the patient, and in the other is a gamma knife machine where you have several seeds to irradiate deep-seated tumors. Well, from this real-time dosimetry, and I'm going to explain later on, we are going to collect a lot of data because we also, besides using the phantom that we're going to develop, we are also going to use the patient data from both hospitals that were acquired previously, and we are going to use deep learning to predict and adapt existing treatment plans and then try to optimize the whole process. So this is what we want to do in these 4 years. And with that, the key results we want to reach. So we want to develop these phantoms. We think they are very valuable, not only for our projects, but they will certainly be used in future projects for other people in Europe, not only in academia. We also want to develop a real-time dosimetry system that can measure position of the being and doses in real time. So if anything, it's out of ordinary, we can stop it. And we believe this can be used in several applications also in the future. We also want, in the case of gamma knife, we want to improve the way the imaging of the position of the patient is done, because in gamma knife, patients usually stay at the couch for longer times. So we want to develop the imaging system that is capable of making better visualization of the position of the patient. And then at the end, we want to, with all the data we're going to acquire, we want to help in the chain for adaptive radiotherapy in some specific case. This is, of course, a proof of concept. And then because the project is already a year and couple of months, I want to show you some of the results we got so far. So within our work package 1 related to the development of these phantoms, so the idea is to have these 3D phantoms with tissue equivalent materials. So we can have lung, muscle, liver, breast, adipose tissue, brain, bones, and then customize it to what we need. In our case, we are focusing, as I said, in 2 different types of treatment machines, but for VMAT, for instance, we are focusing on a lung and a bladder phantoms. And then for gamma knife, we are focusing on large brain metastasis. So here you have some examples of the phantoms developed by the University of Maastricht. And here is the ones that we have now. I will show you. This is a lung, a thorax with movable, breathable lung. So this is how our prototype looks now.
Oh,
We
wow.
can use real patient breathing patterns. So we can also include anomalies on breathing. We can have it faster or slower. And here, for instance, as an example, this is a CT from the phantom. You can see that we have included a tumor, and you can see how the lung moves and how, in a real case, the tumor will also move with the breathing of the patient. And here is another example where you have the phantom, and here on top you have a flexible scintillating sheet, a camera, and this is just to introduce what comes in work package 2. And here the camera, the phantom breathes, the machine moves, and then we have the whole setup ready for work package 2. So where we are in work package 2, in work package 2, what I want to do is to have this real-time dosimetry system, but how can I do that? First, I need the DICOM files with the treatment planning. So I know where the beans should be and what the dose rates should be in each position. So I developed this digital twin where I have the DICOM files. So I have the position of the leaves. I also calculate the fluents. I have the real sketch of the linac moving. Here is also the our phantom now, the one that I just showed, a projection of the beam within this phantom, the positions of this beam, so that I can, with this camera scintillation sheet on top of the 3D phantom, that I can actually measure, and I hope it's going, yeah. So I can actually measure in real time the dose rate that our fake patient is receiving. And these are, of course, real cases of treatment that were used before. So you can actually see the shapes of the being and the intensity and everything. So this is where we are now for work package 1 and 2. As I said, they are very complementary. We want to be able to because we have this digital twin that calculate everything before and then superimpose it with the actual measurement, that we will be able to stop or to evaluate if the treatment plan is actually being delivered to the right position and with the right shapes and everything. And then in the work package 3, where we go to gamma knife, that we have this idea of improving how the position of the face of the patient is being captured, because now we in the hospital they use this camera that only measures the tip of the nose, and then it tells when the patient moves beyond a specific point. But we want something that is better, so something like more, something more like a surface that can give a better estimate of the position. For work package 3, we just finalized our first measurement campaign. The group here in Antwerp University went to Zagreb in Croatia. They did a lot of measurements with the proposed system with the new camera. We don't have yet all the data analyzed. So for this, I can only show you the idea and what we are doing. So that's basically it. Yeah, that was basically it. This is where we are now. This is what we want to do. This is our small but very active consortium group, and this is our very idealistic project.
But it's very productive. Wow.
Yeah, yes, we are very, very active.
Thank you very much, Dr. Luana. This is amazing progress. Thank you so much. Is there anything else you would like to add, just to summarize everything?
Well, I think what I would like to add, this is a very nice example, in my opinion, how different groups with completely different applications can work well in to try to find a solution. For instance, the group working in vision is an engineering group. They do not really work in medical applications, but we could find a synergy, and also the idea of trying to apply the same solutions for VMAT and gamma knife. So it's two completely different machines, but we like to try to see where we can use the same idea in different places. So I like the idea of having people thinking different because we have different problems, but trying to find solutions to the same goal. So that's a very nice project, I would say. I'm very happy to be working with this group.
That makes me happy, and I agree with you 100%. Thank you very much for your time.
Thank you.
And for the enlightening interview or your explanation. The presentation was very well done, and I think it will help us all to understand better about your project. So
My pleasure.